Hi friends, welcome to H2O. I'm Dr. Sashi Kumar. We are going to be talking today about blood clots post coronavirus infection and also post vaccination. So, why blood clots occur? Do they occur at all? And what are the signs and symptoms if they are occurring for people at home? How to diagnose and what is the treatment given? And so, blood clot. How does a blood clot occur? What does a blood clot mean? So, when you get injured, you see after a while the blood stops bleeding. How does the blood stop bleeding? Because of platelets which are there already in the body, they get activated when it gets exposed. So there's an inherent mechanism which activates the platelets and causes clotting. So this clotting starts happening for patients who have the coronavirus infection. It starts after anywhere between 4 days to about 2 weeks time. When they get back home and when they feel that they're totally all right, they get this blood clot, and it can go and clot the brain, it can go and clot the lungs, it's calling it pulmonary embolism. When it gets into the brain, it's called a stroke, cerebral stroke, and when it hits the eye, it's called venous occlusion, retinal venous occlusion. So it can be anywhere. It can affect the speech receptors. It can go to the arms, causing pain in the arms, legs. So wherever in the body it can happen. And why does it occur? That's a nice thing. So there are something called ACE receptors, through which this coronavirus infects and gets into the lungs. Similar receptors are there in the blood vessels. So they go and affect the blood vessels as well, causing the blood vessel wall to get damaged, and after that clotting, hyperclotting stage of the blood also occurs, and which makes it clot, and that causes deep vein thrombosis, pulmonary embolism, or brain stroke, eye stroke, speech loss. Various areas can get damaged. It could be a renal function loss as well. So how do we prevent it? Is there something which is happening, and how serious is it? It's a rare phenomena which is happening, but you should be aware of it. And that's the same reason why I tell you all this is a very important message, and you should share this video and press the bell button and notification as well. So the symptoms and signs I told you, signs would be either some kind of discoloration, so that the doctors see. Symptoms would be the pain which you get, clogging kind of a pain in the legs, in the calf muscles. So what you need to do, what do I need to do? One is taking tablets, anti-coagulation tablets to be taken. I'm sure the doctors would prescribe you, otherwise just check whether that is there or not. And it is given for the COVID treatment patients during the hospital stay and after the hospital stay also for up to 2 weeks. So that is an awareness which you all should have it in mind. And at home, what are the exercises you should do? One is, imagine this is the legs. It's like this. You should keep flexing and extending the muscles, so that the calf muscles here, see here, the calf muscles need to be extended. Keep rotating and work on the calves. Just see this. See this is called the peripheral pump. So the peripheral pump should keep on working. You should give it that exercise. Push, pull, push, pull, right? This kind of motion should be there. And similarly, don't keep lying down. As much as possible, keep yourself in motion. You should be ambulatory and do some small physical workout. Otherwise, clotting can happen. So, shortness of breath also can be there. So, this affects about 30% of the severely ill patients can be affected. And also patients below 50 years also can get stroke. So don't think that only elderly patients can have it. So otherwise, I have told you what is the treatment modalities, how to diagnose it at home, what are the signs and symptoms. So please share this and be aware, and always press the bell button and share this. I'm Dr. Sashi Kumar from Sashi Eye Care, Salem.